toxic shock syndrome.
The notorious tampon disease.
As girls, we've all heard of it and worried about it, but when it comes to the facts, what do you know about it?
You've likely been spewed a whole lot of misinformation, and we're here to clear things up once and for all.
Unfortunately, it's just as serious as it sounds. At-risk populations for the infection include children, teenage girls, the elderly, and those who are immunocompromised. So basically everyone.
We promise we're not trying to scare you. We just really want you to pay attention. We worked pretty hard on this, and of course we care about your safety and whatnot.
Going back to the whole scaring for your life thing, though, we wanted to preface this by saying, contrary to what you may have been told in the past, it's pretty rare, but it can be extremely severe and require hospitalization. So listen up.
Symptoms of the disease include high fever, chills, vomiting, diarrhea, headache, and a sore throat, as well as low blood pressure, a rash, redness in the eyes, mouth, or throat, confusion, seizures, and muscle aches. And these symptoms can progress quickly, leading to shock, organ failure, amputation of limbs, and worst of all, death. And no, it won't clear up on its own.
Most commonly, it's caused by Staphylococcus aureus bacteria, what causes staph infections, but occasionally by group A Streptococcus bacteria causes things like strep throat, which is especially dangerous, having a case fatality rate that may exceed 30%.
Tampons can cause toxic shock syndrome in one of two ways. Leaving a tampon in for an extended period of time increases the risk of bacterial growth in the vagina, especially if you're using one with high absorbency. Removing a tampon can cause small abrasions, creating a portal for bacteria to enter the bloodstream. So no, the chemicals in your tampons aren't the culprit.
Once someone is admitted and diagnosed with toxic shock syndrome, they start antibiotics immediately, specifically penicillin and clindamycin. However, that isn't always enough. Some patients require surgery to remove the infection.
As we mentioned before, pretty much everyone is at risk for getting toxic shock syndrome. And since I'm assuming you at least have some critical thinking skills, you can probably figure that your grandma or dad isn't risking it by forgetting to change their tampon. So how else is the disease transmitted?
Toxic shock syndrome is transmitted through direct contact, often because of a skin infection or surgical infection. Outside of tampons, childbirth, abortion, or other gynecological procedures are common causes.
The good news is it's fairly preventable. Just practice proper hygiene by showering and washing your hands to prevent the spread of bacteria. And if you're going to use tampons, do it properly, which means changing them every 4 to 6 hours and washing your hands before and after doing so.